Okay. Okay, today we're going to go over the parts of the pulmonary artery catheter or Swan-Ganz catheter. So for the catheter, it is a 110 centimeter catheter. You have these small black lines on it that are 10 centimeters. That would be 20. That's 30, and at the 30 centimeter mark, that lets you know that you're in the right atria, and it has a port here. And then it also has another port that's there for the infusion port. So this infusion port on this particular Swan is this white port. So you have these 4 lumens on this PA catheter. You have the balloon port. This is the port that you use to it's a 3 cc syringe again, and it goes only to 1.5 cc's so that you can blow up the tip of this balloon. And then this when you blow up the balloon as it sits in the pulmonary artery, it occludes some of the small vessels in the pulmonary artery so that you see indirectly the preload or the right atrial pressure. The blue port that's on here, which corresponds to the blue waveform on the monitor, is the CVP port, or the central venous pressure, and it's the proximal port, and the way that I remember that is CVP proximal. And so with that, you would need to hook up the pressure transducer to this port, and then you would also, to do the cardiac output, you would hook up that catheter to, you'd hook the cardiac output syringe to the CVP port, right? And then the other port that you have, the infusion port here is for, like I said, it's that port at the 30 centimeter mark from the tip that you can do medications and just infusions through it. This yellow port here is for the pulmonary artery port, and so you would also need to hook up the transducer to that port so that you can have the waveform for the pulmonary artery. And so when you have to insert a pulmonary artery catheter, you would need an introducer. This is a single lumen introducer, and you would, after it is placed in the, usually the right IJ, you would thread this through. And once it gets to be about at the 30 centimeter mark, they would blow up the balloon to help this catheter float with the direction of the blood flow, and have the catheter float into the pulmonary artery. And so, again, on the centimeter markings, the thin ones are 10, and then this big black mark would be 50 centimeters. So this would be the 60 centimeter mark. But then you would have to, after it's inserted, I'll lock it in place, shield or sheath, to lock it in place. And then if it were to get pulled out of place, then you could unlock it and then adjust the catheter and then lock it back in place. Now, for each one of these lumens, there is a corresponding waveform, so that when you're looking at the monitor, there's distinct waveform for what a CVP waveform should look like. So as you're floating this catheter in place, we have when it sits in the right atria, you have this waveform. And then as you push the catheter in a little bit further in the right ventricle, the waveform should look like this. And as it is in the pulmonary artery, then you should always have this pulmonary artery waveform. And then when the balloon is blown up, the tip of that catheter moves forward a little bit and it occludes one of the capillaries, so that you're looking indirectly what's in the left atria, and that is the waveform that you should be seeing. And then you want to make sure that when you're rounding and assessing your patient, that the balloon is not, the waveform does not look like this. It always should look like this.